So today we're going to talk about frozen shoulder, but really things that mimic a frozen shoulder. We see this all the time in our office, and specifically today we're going to be talking about things in the shoulder that can mimic a frozen shoulder. Now, we have other videos talking about if you have frozen shoulder, doing some of these exercises, but a lot of times when people come into our office, we're like, this is not frozen shoulder. It doesn't present like frozen shoulder. So we'll go into kind of how this presents, which is different than how a frozen shoulder would present, but really easy for a doctor to be like, oh yeah, that's probably what you have, because there's not really any conclusive testing that's going to move us one way or another. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. We help put the pieces of the puzzle together. So often in our healthcare system, we go directly to the side of the pain, and we always say where the side of the pain is often not where the source of the problem is coming from. And there's a lot of things that can mimic conditions that our doctors say, oh, that's what it is. And I'm here to tell you there's so many things that you can do from a holistic, natural way to get your body back. So let's go into what we're going to be talking about as far as a condition in the shoulder that can mimic a frozen shoulder. Now, in our PTT world of where I've been trained, we call some of these shoulders shoulder derangements. It means that there's material in the shoulder joint that's kind of been displaced. Now, there's bursas where there's a lot of attachments to muscles where you'll have bursas. And when you do repeated motions over and over and over again, it can displace this and it creates problems in our shoulder that can, again, we can get resolution for something like this really quickly. So one of the ones that is the most common one, now there's other ones out there, and if you're not really sure, definitely make sure you get to someone that understands how the shoulder and how the body works so that they can figure this out for you. But the most common one we're going to go through today, and typically what we find is, if someone really truly has a frozen shoulder, they're going to have a capsular pattern. And what do I mean by that? That's when their external rotation is their worst range of motion, and then internal rotation is the next worst. Abduction out to the side is the next worst, and flexion is usually the best, but still limited. And that's what we call a capsular pattern. And people will think that, oh, that's what this is when someone has what we call kind of a shoulder derangement, because they'll have issues with flexion, they'll have issues with abduction, they'll have issues with bringing the arm back, and they'll even have issues with internal rotation. Now, sometimes they can have really good extension and less internal rotation. Usually if they have less extension, they usually have less internal rotation as well. But a lot of times their external rotation isn't that bad. And when you're noticing, like, wait a second, why is external rotation actually better than internal rotation? You start thinking, this is probably not a frozen shoulder. And so that's what we're going to go into, talking about how you can solve this. So, how do we kind of get these conditions? Like, we'll find people, they've been painting, and they painted, and they're in the motion like this, and they're not used to doing this, but they do it repetitively. All of a sudden, they start having issues within that shoulder, and they're like, golly, I just woke up one day, and it kind of tightened up, and now I'm having a hard time reaching up or going out to the side. We've had rock climbers. They're like this. Very common. You're putting a lot of force, and your body's repeatedly in this position. These are common things. When we start asking people, like, what are the things that make it worse? What are the things that make it better? What is your lifestyle? What does a day look like? We start putting like repeated patterns together. I'm like, oh, this is potentially what could be going on. It helps us understand what direction we need to go into. If they're saying things like, yeah, man, I'm always, when I'm always bringing my arm up and I'm always doing kind of flexion, that's when it's at its worst. It actually feels good to kind of stretch it back, but I'm afraid that if I stretch it too much, that it's going to be bad for my shoulder. We'll hear things like this all the time, but it gives us clues as to what direction that we need to go into. Now, there's a couple of directions, and what I usually say is we start in the sagittal plane, and we want to see the shoulder's the most mobile joint in the body. So a lot of times, we can get some clues by starting in the sagittal plane and then moving into a little bit more lateral. So the first direction, what I want you to do is taking range of motion. Range of motion in your shoulder. I want you to take range of motion, bring your arm back. I want you to take what it feels like going back this direction, and even behind the back. What does it look like when you do motion like this? And so get some baselines first so you can really see, like, okay, is this getting better? Is it getting worse? Or is it staying the same? Then this is the motion I want you to start out with. Now, you can put your arm up on something or make a fist, palm facing up, and you want the palm like this up against the wall, put a little weight into it, and you're just going to stretch that shoulder joint. Now, I have a lot of motion in my shoulder, so you can't look at me as an example, but you're just going to go to the point where you're like, yep, I feel that, and then you kind of come out of it. Yep, I feel that, and then you come out of it. And I want you to do that 10 times, and then rest for just a little bit, and then retest the shoulder. Did the shoulder improve in range of motion? Does it feel better? Is it less painful? Can you move the arm back? Is it better coming back like this? You're going to look at that. And if you notice that, yeah, wow, 2 of the motions really improved, or maybe 3 motions improved, but I'm still having a little bit of issues with some other motions, then we know that we're moving in the right direction. Do another set of that and then retest it. If you feel like it's helped a little bit, but you're still having some issues, then we're going to go into the next motion, which is you're going to use a strap. And you're going to take this strap, and what you're going to do is you're going to put it over the opposite shoulder. So if my right shoulder is my problem, you're going to put this on the left shoulder. You're going to grab the strap. Palm's going to be facing back, and you're just going to bring it up, hold to where you can kind of feel it, and then come back down. And again, bring it up, hold to where you kind of feel it. If you don't notice it as much, you can also squeeze the shoulder blades back a little bit. That's going to give you a little bit more of a stretch, and then come back down. Doing this again 10 times, and then I want you to go back and then again, retest those motions. Retest the flexion, retest the abduction, retest the extension, retest the internal rotation. If you're continuing to notice that, wow, I'm getting improvements, then you're moving in the right direction. Keep doing those 2 to 3 times a day, and you'll notice in about a week or 2, your motion's going to be better. If you feel like it's plateaued, then we need to add a little bit more force. I can show you other things like that in another video. Now, let's say that it's plateaued, and you've added more force, or you're like, God, it kind of worked, but now it's made like this has gotten worse. Like this got better, this got better, this got better, but now it's like, wow, this is a little bit worse. Then we want to do the extension in a little bit of a different direction. We want to do the extension. So I showed you with the palm up. We want to do it with the palm down. So we're going to add rotation in the opposite direction. Same kind of thing. Face up here and then go down. Make sure we keep our chest up and that we're not going like this because you won't get as much motion. But you go in and do it like this with the palm facing down. And do again 10 of those, then go back in and retest this and see if you notice a difference. So if you're noticing that everything improved, but man, behind my back rotation, we call this internal rotation, functional internal rotation, it got worse, then you just want to make sure that the palm faces down into that extension and do it that direction, and that should clear that up. The shoulder, again, is so mobile, and there's a lot of other directions we can go into, but there's certain patterns that we see. This is the most common pattern that we see, so it's the one that I start out with. And again, the differences between this versus a frozen shoulder is the fact that, external rotation, going backwards like this, should be the worst motion, then followed by internal rotation. So if you notice like, wow, it's tight, but I can move back, but my internal is really bad. I can barely move it through here. I can't go back. I can't go like up is tight, out to the side is tight. More than likely, you're looking at this shoulder derangement, and these exercises are going to work. If you're noticing that, oh, I'm super tight this way and I'm super tight this way, you're really tight in all these other motions and you present like a capsular pattern, make sure you go to one of my other videos because we'll show you different joint stretches that you can do to start giving you some relief today. So check out my other videos. We have other videos in the description on frozen shoulder. I'm going to be doing another video on when the neck, thoracic spine can be an issue causing something that can mimic a frozen shoulder. So make sure you check out one of those videos next up.